program gets underway. The AU issued its update for the continent today, where it reviewed South Africa, Tunisia, Nigeria, Zambia, and Malawi are top 5 countries reporting the highest number of new cases on the continent. Fred Smith joins me with more. Hello, Fred.
Hi, Gifty.
Fred, so give us a little bit of a background to this conversation.
Well, the Africa Union's health arm, the Africa CDC, they are responsible for managing the outbreak in Africa. And what they're doing is to try and get about 60% of Africa's population vaccinated so they are protected from COVID-19. Then they see what they do with the remaining 40%. And they've been looking for funds to do this. If you recall, at the weekend, we had President Akufo-Addo leading an African leaders meeting on Zoom to decide how to raise money to undertake the vaccination. Indeed, MTN yesterday presented $25 million to the Africa Union to help in this regard. And the Africa Union says this donation will help greatly towards achieving that 60% coverage for the vaccination that it plans to do. It won't happen immediately, but at least 2 or 3 months ahead of us, the Africa Union will begin this vaccination. But they said this in an update they've issued. The Africa Union has been updating African citizens on how the COVID situation is going. And as of today, the African countries or member states of Africa are reporting 3,494,117 cases. That's around 3.5 million cases, which accounts for about 3.5% of total cases reported around the world. And the world, as we speak, has reached 100 million cases of COVID-19. The deaths, though, are around 2.9 million, roughly 3 million recoveries are added. Which is about 85% of the total cases reported so far. 87,937 persons who contracted this disease in Africa have died so far, and that presents a case fatality ratio rate of 2.5%, and that's also accounting for 4% of deaths around the world. So the data you gave earlier, the 5 countries accounting for 69% of all cases reported in Africa are South Africa, which is 1.4 million, making up 41% of cases in Africa. Morocco contributes 13% at 468,000 cases, and Tunisia with 6% at 202,000. There's Egypt, which has 5% contribution at 163,000 cases. Ethiopia with 135,000, which is contributing 4% of total cases. Ghana is not at this level yet. But it also gave a list of countries contributing to the highest number of new cases. So South Africa, for instance, they are contributing 75,000 new cases so far in the new cases reported this month. Tunisia with 16,000 cases, Nigeria 11,000 cases at number 3, Zambia with 7,000, and Malawi 6,925. There are 5 countries with the highest daily incidence per million population on the average. That's the number of new cases per million population each day. And you have Seychelles, Tunisia, South Africa, Eswatini, and Cape Verde in that order. And if you check, over the last 4 weeks, from 28th of December to the 24th of January, there has been a 4% average increase in new cases reported in Africa each week, each of the 4 weeks since 28th of December. And on the average and by region, there has been a 9% decrease in eastern region, the eastern part of Africa, 4% decrease in the northern part of Africa. You're talking about Egypt, Morocco, Tunisia, and other countries in that region. And there's been a 16% increase in central part of Africa. That's very worrying. 7% increase in southern region and 21% increase in the western part of Africa, which is where Ghana. Yes, Gifty.
Which is where Ghana comes in. I was just going to say that it looks like a lot more figures, which our viewers will have to absorb. But to wrap up, Fred, if you can just help us with a bit of what we know regarding collaboration, because people have said that even if you have the money, there are issues in Europe over hoarding, for example, of the vaccine. So even if you have the money, to what extent are you sure of getting the vaccines? Has that been part of the conversation so far?
Well, it's the reason why the Africa CDC is partnering, is looking for funds, actually. The president joined other presidents around the continent to decide on how to raise funds to pursue this so that we are not totally dependent on other persons who may decide whether to send in the vaccine or not, or your ability to acquire the vaccine depending on whether you have money or not. And so it is for this reason that the business community has started responding, and with the MTN giving them $25 million to support this. And the expectation is that other businesses operating on the continent and are doing well will come in to support, so everybody who needs to be vaccinated receive the vaccination.
Fred, thank you. Thank you very much. I think that with time we can also have more of such conversations, especially about what Africa itself can do together to get its own vaccine, perhaps. Well, let's go to Europe, where several thousands are dead. There is a growing concern there also about the new coronavirus mutations, especially after a new variant was found in Bavaria again. An entire hospital was put under quarantine in Berlin after around 20 cases of the B117 variant, which apparently originated from the UK, was found. Here in Ghana, government says inoculations should start by June. Well, there's also growing controversy over vaccine distribution issues like